So we'll look at the next concept of membrane ruptures, and this is what is known as a spontaneous rupture of membranes. Spontaneous rupture of membranes. So the membranes is just basically the amniotic sac. It can rupture, then you have the fluid coming out of the vagina. This will basically alert the healthcare providers that labor will soon start. So for spontaneous rupture of membranes, it just has to do with what? It just refers to what? Natural breaking of what? Amniotic sac. Okay, so commonly it's known as water breaking. Okay, so it's the water that is breaking, all right, without any medical intervention. So it typically signals that what? Labor will soon start. Okay, but timing and implication vary depending on the gestational age. Okay, is this water breaking on time, or is this water breaking too early? So what happens during this spontaneous rupture of membranes? All right, we'll see it. You just have to do it. The amniotic sac ruptures, it will release fluid, and this fluid will pass through the vagina. Okay, it may be a gush, or maybe it's just flowing slowly. Usually occurs after 37 weeks before labor begins. So types and timing is, we have the term spontaneous rupture of membranes. This one, it occurs at week 37 or after week 37. Preterm, this one is before week 37. All right. Then premature, this one is like before labor starts. Then preterm, this one is before 37 weeks. You understand? So this is just it for the different types of spontaneous rupture of membranes we have. Risks and considerations: as that water is leaking out, it can now form a fertile ground for microorganisms to grow on. So it can lead to infections. It can make the cord to prolapse, because the cord is high up here because it's the amniotic fluid that is keeping it to float. If amniotic fluid is leaking out, the cord can prolapse and even block this birth canal where the baby is supposed to pass. Labor delay. Right? If labor doesn't start within 24 hours, then you have to induce labor, because if amniotic fluid is coming out, basically you need to induce something. Then group B streptococcus infections. Okay, if you are suspecting that, then antibiotics may be used before time, just to prevent it. So what to do if this happens? So note the color. Is it smelling? Okay, and what amount of it is actually going out? Avoid tampons, bath, or intercourse during that time. Monitor for fever. Okay, and if the baby's movement is reduced. Okay, then you contact your healthcare provider immediately. So management is just expectant management. You just wait for labor, to begin naturally. If the labor doesn't begin naturally, you induce the labor. Okay, then if you're also suspecting infections, you use antibiotics to prevent it.